Welcome to our video. Today we're going to be talking about cupping therapy and when it goes wrong. Now you've probably been clicking through lots of videos and I'm sure you've been on your journey looking at cupping therapy and all the different ways that it's applied, and you're probably thinking to yourself, wow, that looks really dangerous or that really looks painful. But I'm going to highlight to you the areas where cupping therapy can go wrong and where it has gone wrong. But I also want you to understand that cupping therapy in general as a treatment modality is not a high risk therapy. It's not as bad as taking an injection or having taking some of the drugs that you can take. If you look at some of the pharmaceutical drugs and you have a look at all of the side effects, cupping therapy doesn't even touch the surface in terms of its risks. So it's a very minimally invasive, very low risk therapy, but there are some things that can go wrong. So we're going to highlight what those are in this video today. Cupping therapy is performed in many different ways. So depending on the techniques that you use, there's different risks and benefits associated. So mechanical vacuum cupping can be used, where we use suction cups and pumps, where we draw air out of the cup using a mechanical vacuum. You've probably seen these cups before and you've seen them in our videos. And this is where a mechanical vacuum is used to create the suction. We also have fire cupping techniques where a flame is used to create the suction, and this is when we take a burning flame, we place it inside a cup or a vessel, and we quickly take the flame out and we put it on top of the surface of the skin. As that air cools down, it condenses in its volume and it reduces down, which creates a negative pressure or a suction. There are other ways of doing fire cupping, which we call the candle method, where you create a little small candle type flame, which you put the cup on top of, which creates a suction. There are also other methods of cupping therapy as well, which use what we call screw cups, where we screw the cup and to create a suction. And there's also methods where you use, or very old methods, where you use oral suction, where they actually use their mouth on a cup or a vessel and they suck the air out with their mouth. You need a good pair of lungs to do this, but this is one of the old methods where they used to use oral suction using animal horns most of the time. So these are the three main methods. You may have seen us use silicone cups as well, which are cups which you kind of squeeze and you reduce the suction, you reduce the volume of them and then you let go, which creates a suction. So these are the general kind of types of cupping that you may come across. And there's also wet cupping, but I was talking about the different ways in which you create suction. So the first risk there is, and you may have seen if you've looked up cupping therapy, I'm sure you've clicked on some of these videos where we're talking about the cups being left on too long. So regardless of how you make the suction, if you leave the suction cups on too long, they can create pressure sores. So if you've seen these horrible marks from this guy in the Daily Mail, which apparently in China he had these cups put on him, and then he was left with these horrible black marks. Now to be honest, I think that those videos have been, or those photos have been photoshopped in some way, because it just doesn't add up. That's not how those types of marks would look. Even though they're burns, they shouldn't come out black like that. But anyway, it is a possibility. You can form burns or sores or blisters on the surface of the skin when the suction is either left on for too long or the suction is too strong. So you can have it from both of those, and the worst is when there's a combination of those. And that can often be the case with particular types of cupping, especially with bamboo cups and some of the fire cupping methods, which create a very, very strong pull. The burns to the skin are a possibility, but in order for this to happen, really people need to be doing things very wrong, and they need to be leaving the cups on for way too long. I get a lot of therapists that message me and they say, look, I'm getting these blisters on my patients after I'm doing cupping. The reason is you're leaving the cups on for too long. You shouldn't be doing that. And we provide training for practitioners to help them understand what they should and shouldn't be doing when using cupping therapy. Another risk of cupping therapy is burns from a different way. So not pressure burns or pressure sores, but burns from the actual flame. Now this can happen in any situation, because when you are using fire to create suction, there's always a fire hazard. So you have to be very cautious about this, and there are safety protocols and procedures which we teach and apply, which you should be using when using a flame anywhere near a patient in the context of fire cupping. Now, there's a few ways that this can happen. Number one is you can sometimes have a small amount of the cotton ball or the flame which falls onto the patient, which can cause a burn, which we have had happen in one of the videos which we recorded, which is drawing up any inflammation to the surface of the skin. Oh, Oops. You can also have the cup or the vessel heating up. So sometimes when we're using the fire cupping, we use the cotton ball and we're putting the flame into the cup. Now if you leave the cup, the flame inside the cup for too long, the cup or the glass itself can burn or get very hot. And when you put that onto the surface of the skin, that can burn the patient. And I've seen this with patients where they've got round circular scars from cupping, and that's a really, a very easily kind of avoidable kind of side effect that you can have from cupping just by checking the temperature of the cup and just being careful. Some of the other risks and side effects of cupping therapy are soreness, and this is probably one of the most common things that you can get, is that after you've had the cupping therapy, even though they look kind of horrible, it looks like kind of you turn people into kind of bubble wrap backs, as we say, where you've got all of these kind of bulges on them. That actually doesn't hurt. That's usually, when it's applied properly, really harmless, and actually feels very relaxing. Even though it may not look it, it looks it feels very relaxing. So you can sometimes be sore if the cupping was done too strong, or if it was done in an area where you've already got a problem. So those are some of the risks and side effects that you can happen with cupping therapy. There are a few more, which are in more rare circumstances and related to wet cupping therapy. Now I want to make very clear that I'm not talking about wet cupping right now. This is the one where blood is released from the surface of the skin. Maybe we'll have another time and a place to go into that, but these are some of the ways in which cupping therapy can go wrong. But there are very simple procedures and protocols that you can follow to avoid that from happening. If you've enjoyed this video, please subscribe. We're going to be sharing lots more content and lots more videos as we go on. And turn on your alerts so you get alerted as soon as our new videos are out. We will be replying to all the comments that are made on the posts. And also share the love and share this video to anyone who you know that might be interested.